So our objectives today is really recognizing that CHW sustainability is achievable when you have the right resources and tools, and you successfully learned how to actually use these tools in the correct way. It could really enhance your sustainability plan. And also, while you're working on your sustainability plan, we want to make sure that we are elevating CHW voices with the support of true CHW allies. Next slide, please. So I am going to be a presenter for today as well, but I already introduced myself, so I'm going to pass it to Essie and Yasmin to introduce themselves to you all.
Thanks so much, Mengshi, and hi, everyone. My name is Essie. I'm a CHW and Envision CHW Sustainability Lead based at the University of Wisconsin-Madison Population Health Institute. Through that role, I manage the Community of Transformation program, and I provide training and technical assistance to communities that are working towards CHW sustainability using coalition building and power building strategies. Prior to Envision, I worked in direct services as a CHW and community organizer in rural Colorado, and I provided care coordination services to address social determinants of health in my community with a focus on promoting mental health, access to resources, and equitable housing opportunities through policy change. Yasmin?
Thanks, Essie. Hi, everyone. So good to see you all today. My name is Yasmin Aftahi. I'm a CHW ally, also based out of the University of Wisconsin-Madison Population Health Institute, and my title is Envision Resource Coordinator. So what that looks like is capacity building from the perspective of resources. So there's so many great resources that we're going to talk about today, but ways to get plugged in, and that's what I'm doing with Envision. My background is in policy and international policy and global health policy. I am the first generation born here. My parents are refugees from Iran, and so definitely bringing my family stories with me in everything that I do. And I'm so excited to be here with you all today.
Thank you. Can we go to the next slide, please? So a quick recap of our summit, right? What are some of the summit highlights and lessons learned that Envision, like we were having a discussion on? So basically, after spending 3 days with our recipients and our national partners as well too, and sitting in conversations with everyone, we came to realize that, you know what, CHW sustainability is possible, right? And we were able to pinpoint 3 key components that really helped us kind of understand that can make CHW sustainability possible. And they were leveraging our relationships, dedicating initial time to this work, and elevating CHW leadership with ally support, right? So what do we mean when we are leveraging our relationship? If you look at the essence of CHW work, it's all about relationship, right? We have amazing relationship with our community. We also have amazing relationship with the systems that provide services to our community and partners. So we're able to navigate that to address health outcomes in our community. But we also could use that same strategy or that same structure for workforce work as well too, right? So not only are we doing this on a community level, but let's use that same structure for helping our workforce, right, sustain our workforce as well. And then dedicating an intentional time to this work, right? Making time to collaborate with our partners to learn about available resources and tools out there for us, and build relationships strategically and engage with what is happening for the workforce at a local, state, and national level. We want to make sure our narrative and our work is aligned with one another so it stays consistent. And then lastly, elevating CHW leadership with ally support. So understanding the importance of CHW leadership and why CHW voices are essential for sustainability. So identifying and fostering relationships with true allies who value CHW leadership and voices. So I'm going to pass it on to Essie to dive deeper into some of those concepts as well. So I'll pass it on to you, Essie.
Thanks so much, Mangshi. And just want to say hello and thank you so much again for letting me come and speak with you all. I'm really excited. We have 134 people on the call. Too cool. Really great. Excited to see how you all are engaging, and please ask questions in the chat and save them also for the end when we have some Q&A, because we're going to cover a lot of ground today. So like Mangshi was speaking to, Envision's approach to CHW sustainability really centers on increasing CHW power, elevating CHW voice with ally support. And power, simply put, is the ability to act and to make things happen. Strengthening our capacity to make things happen is the key to sustaining the CHW workforce. So how can we do that? How can we grow power? By building relationships. And building relationships is essential to growing CHW and ally capacity. This approach that we're talking about is shown in this model on the screen. So the model is a cycle, and you can start at any point. It really emphasizes beginning with what you know and building on relationships and insights from the community. Since CHW work is all about relationships and the understanding that we have with our communities, you might start with the right of the triangle by creating an inventory of the resources and relationships that you currently have with individuals, organizations, networks, etc. Next comes power analysis, and this is about being able to identify where and who holds power currently and influence in your community. And this is where you might use a tool like a power map, which Envision also trains on and is referred to in the guidebook. And you might use that power map to plot out the relationships from this inventory to determine who has influence with decision makers and where you need to spend time building alliances. Then you will directly impact decision makers by strategically developing relationships and aligning interests to increase CHW influence and address those community needs. So through a combination of data, community stories, and one-to-one meetings where you're really listening for what people care about and what issues they are focused on, you can then make a connection with them and find out where your interests and their interests intersect. And this is going to build champions, leaders, and coalition around the effort. And power is demonstrated by us holding decision makers accountable. This is done through follow-ups, reviewing the decision-making, and continuing to foster the relationships so that you are kept updated and you know what's coming. Then you'll reflect and evaluate on how things have been going, where they are, how far things have moved, and analyze how your power has built and will continue to build as you build those relationships. So each point on this triangle contributes to the broader CHW movement, and it amplifies CHW power, which in turn does advance workforce sustainability. Next slide, please. And just so y'all know, we're going to show you a couple of graphics and we'll explain them. We've introduced some of these before, but we feel like the more we talk about it, the more we can talk about it with ease. So we're talking about sustainability a lot. What does that mean for CHWs? Envision emphasizes 4 interrelated approaches to CHW workforce sustainability, and we covered this during the summit: community leadership, policy changes, institutionalization, and securing resources. Obtaining continuous revenue funding for CHW programs is crucial for sustainability, but it's only one aspect. We need to systematically embed or incorporate CHWs into existing institutions such as health departments with training and guidelines that are informed by CHWs. To ensure long-lasting change, we also need to modify or create rules, regulations, and policies. But sustainability isn't just about policy and structural change, right? It's ensuring that the policies and the structures made are equitable, which is why it's so important for community leadership and ownership. That means prioritizing the leadership of CHWs to be the driving force behind CHW workforce sustainability efforts. Next slide, please. So here's another graphic, and this is really about the relationship between CHWs and CHW allies, and Yasmin's going to talk more about this. But it's essential to emphasize that without CHWs and CHW leadership, sustainability is compromised. That is one of the biggest takeaways that we have from the summit and from all the work that Envision has been doing, that so many folks have been doing in this workforce for decades. In some cases, though, decisions about the workforce have been made without involving CHWs, which can hinder sustainability efforts. So to address this issue, the American Public Health Association CHW section created a policy on CHW self-determination, which states that at least half of any group making decisions about CHWs should be CHWs, right? That said, both CHWs and CHW allies play crucial roles in this work. So that CHW self-determination policy really serves as the foundational building block of this model that you see, which illustrates the principles for partnerships between CHWs and allies. With CHW leadership and representation, collaborative agreements can confidently be established on decision-making processes. With CHW leadership, we can know that we are moving forward in an equitable way, and that what CHWs actually want is what's happening in these decisions and with these policies. Having CHW leadership ensures that critical issues related to sustainability, such as the definition for CHWs, training standards, and other professional parameters, are made by and again for CHWs. By centering these voices, we pave the way for the effective implementation of all the approaches that we've mentioned at the top of the triangle that are inclusive, and they reflect the unique contributions and impact that CHWs have on community health, things that CHWs can and do that no one else can do. So CHW leadership and ally partnerships are really strengthened, again, through this idea of expanded and growing our relationships, growing the reach and the influence of CHW leaders and ally partners while building the CHW workforce sustainability movement. And as these relationships, they deepen and they grow, they're going to serve as a catalyst for collective action and being able to amplify all of our power together and the impact of CHWs and allies in advancing these goals towards sustainability. Again, you're going to hear more about the relationship between CHWs and CHW allies and what true, authentic CHW allyship looks like from Yasmin a little later. And for now, we're going to dive deeper into the power of our relationships. Next slide, please. So we really need to be thinking about, this is one of, again, the huge takeaways from the summit, our relationships as a source of power, each and every one of us, individually and collectively. And expanding our relationships, growing, fostering them, maintaining them, it's an accessible and limitless source for growing CHW power. CHWs demonstrate this power daily in our communities. We cultivate and sustain trust through meaningful engagement strategies like bonding over shared experiences, staying in touch regularly, connecting individuals and families to resources, and adapting to changing needs and priorities based on what the community needs and wants. So CHWs and allies can apply this exact same impactful approach, the very essence, the intrinsic nature of CHW work, to relationship building with decision makers to achieve sustainable CHW programs, which is really, really exciting. What we want you all to hear is we all have power already in the relationships that we have, and there's something that each and every one of us can do, and it doesn't cost anything. It really costs our time. That's what the cost is, intentional time. So the next thing we're going to do is we're each going to really think about, I would love everyone to get out a piece of paper and something that they can write with, or to open up a document, or if you don't, like on your computer, and if you don't have access to that, you can just type in the chat without hitting send yet. But to think about, take a moment to yourself. We're going to reflect and have some music on. Who are you in relationship with? So think about that. How did you establish those relationships? And then how do your relationships enable you to do CHW work. So think about anyone in your personal, professional circle. We're trying to think of it through that CHW ally lens, but really to think about who are you in relationship with? Are they local organizations, the libraries, individual families, clients, anything like that? And we're going to share together. We're going to have people drop their answers into the chat, and we're going to have a couple folks have the opportunity to come off mute and share. But for now, we're going to take 1 minute, at least, maybe 2, to reflect while we have some music on, and everyone to kind of jot down the answers to some of these prompts. So take about 10 seconds here to wrap up some of your thoughts. This is just, for some of you, you've done this many times before. Some of you, maybe you've done it a couple times. And for some of you, this may be the first time you've really thought about who you're in relationship with. But what we're going to do here now is we're going to talk about it together. And I see that we have folks who are dropping into the chat, and I love to see it. I see public schools from Arien or Arlen, I'm sorry. Arlen dropped into the chat, and let me know if I'm pronouncing your name incorrectly, please. I'm looking at my second screen, so if it looks funny, that's why I'm looking at the chat over here. Public schools and libraries, Yuma County and other nonprofit organizations, Consulado Mexicano. And Yanira said, here in Spartanburg, South Carolina, I'm in a relationship with several nonprofits that are partnering with our program. Their partnership is so important in helping our clients that it would be impossible to help them without their assistance. Absolutely, to be able to connect with our clients like that. Joanna says parishes in San Joaquin County, being part of the diocese. Tell me what that is. Tell me what this is that you're talking about, Joanna.
I work for Catholic Charities,
Mm-hmm.
and we are part of the Diocese of Stockton. And the diocese, well, there's dioceses throughout the United States.
Mm-hmm.
So we partner a lot. We do with the community as well, but some of our main focus is on some of the parishes where people come from Mexico,
Mm-hmm.
and they get here and they need a lot of services, and they need it to be culturally sensitive,
Mm-hmm.
and to help them. I mean, some things that we think is very simple, you know, even navigating the phone, you know,
Mm-hmm.
where to get insurance, and when you weren't able to get insurance, where to get services, because if you have unhealthy household, you have unhealthy communities
Mm-hmm.
and schools, and it goes on and on. So that's where we started. But we do partner with everybody in our community. I've been doing this for 21 years. So I know a lot of other CBOs, a lot of different things. And what I don't know, I know who knows. So
Mm-hmm.
it's holding the little baby steps. You can give somebody that comes in, you know, a stack of papers, here's resources, but it's the phone calls and sometimes going to the home, you know, that doesn't even have a road to get to the home. So it's those little things.
Thank you so much. Thank you so much for elaborating on what you shared there, Joanna. And I just want to really lift up, and other people too, what you heard from what Joanna shared, which I heard how much of that trust building, whether that's a phone call or being able to go there in person, but that trust building, that's what was needed to build relationships, right, with folks, and to see what they needed and to really listen and to care. And I also heard you talk about how if you don't have something or you don't know where something is, you know someone who does. And that's a part of the power of your relationships, that you're able to connect and get those resources for folks. So thanks so much for sharing that and for everything you've done for 21 years and beyond. Appreciate it. Let's see, we got love for the music. We also have Alejandro says libraries, food pantries, community centers, key leaders. CHWs in Syracuse, New York have relationships with food pantries, senior centers, and lots of folks here. I'm going to read just a couple more. To attend as many professional events as possible, get business cards, make a database containing who you met, where you met with them, what was discussed, connect with them in a few days. Such a great way to build and grow relationships. That is an excellent piece of advice there from Richard. Thank you. Would love to, let's see, just have one more person come off of mute to tell me about how you establish some of those relationships and how they enable you to do CHW work, to just share briefly with us some details, maybe for a minute or less. I see Olga and I see Courtney. We'll have both of you share. Courtney,
Okay.
since you were just chatting, why don't you go ahead and share for, if you can give us somewhere between 30 seconds to a minute, and then Olga, and we will absolutely continue to have this conversation as time goes on.
What are we talking about?
Oh, I thought you came off of mute because you wanted to share, Courtney.
Oh, I'm as far as being a community health worker.
What we're talking about is, how did you establish the relationships that you have right now as it pertains to community health work, and how it enables you to do community health worker work?
Yeah, I like helping the community out. I like to volunteer everywhere. I like to be out there in the community, get to know people, like stuff like that.
Mm-hmm. So putting yourself out
Put
there,
myself out there, like really
Mhm.
out there.
putting yourself out there and doing, I hear you talk about volunteer work. So that's a way that
Yes.
something you care about and somebody else cares about it, obviously, because they're volunteering and you already have that shared connection. So you're able to
Right.
build a relationship that way.
Yes, yes.
Thanks so much, Courtney.
You're
And
welcome.
Olga?
Hi, good afternoon. I'm a promotora de salud, a community health worker in central Wisconsin, very surrounded by rural area. And so it was very difficult for us to start building those relationships, especially because we are in a rural area. But it didn't stop us from going door to businesses to introduce ourselves and the work that we do. Especially I work highly with the Hispanic Latino population. And a lot of them have like language barriers and also transportation barriers. So I needed to, to go to them and looking for those employers and letting them know that, the work that we do to connect them to resources and, the equity work, been doing it for about 3 to 4 years now. And so that's how we started to establish our, who we are. And so we're very well known in the community now. So we built great relations with the nonprofits, the local farms, the factories, and even the local businesses and the health department. I work for the health department where I live. And so now that I've been a part of, the committees and meetings and everything, I've also built relationship with DHS. So, the importance for them to also, see the needs that are here in central Wisconsin, where versus urban areas have more access to resources and more opportunities, where here we are in the middle of smack Wisconsin. We have nothing and no resources really for culturally appropriate for our community. So see how we can, assist our community. So I started as a contact tracer and also interpreter, but now I'm a community health worker, as well as a doula and peer specialist. So I wear many hats in our department because it's very needed, and it's hard to find like that, bilingual personnel that wants to, service the community in a lot of different ways that it's needed, especially the connections that we made with the health systems. So like Aspirus, Marshfield, and the health departments that surround us. We've built those relationships to also assist them in helping their communities as well, like the way that we got connected. And it's just very important to also be the voice of the community by participating in committees, coalitions, meetings. And so that's really important. That's all I wanted to share. Thank you.
Thank you. Wow. Thank you so much. So many incredible tidbits and nuggets there. And I'm sure that many, if not everyone on this call, can relate to what Olga was sharing. I hear so many themes of that trust and presence and that time, and just showing people that you are reliable, and that, yeah, we will go door to door. That's putting in the time and putting in the relationships and meeting people's needs, showing them again and again, we are here for you. Totally hear about the rural lens and wearing many hats. That's definitely a part of the work. And I know that from my personal experience, working as a CHW in a rural community as well, that it takes a lot, so much of it is presence, being there, listening, and then showing up for people and doing something when you say you're going to do it, right? And that's a lot of it. So many incredible folks and that they've put here in the chat. Please continue to drop in here, how you're seeing your relationship as a source of power, how it enables you to do that work with partners, and really just kind of what's coming up for you through this. Next slide, please. So want to say thanks again for taking that time to discuss it. And I know a couple folks came off of mute and many folks put it into the chat, but to really be thinking about how these relationships that you have been a source of power to you, and they actually do enable you to do the CHW and ally work. We've been talking about power a lot, and we want to define power again. When we say power, what we mean, simply put, is the ability or the ability to act or to do stuff. And when you bring several people together, then you have collective power. So CHWs and allies do have that endless source of power to tap into, and that's through our relationships. And let's continue on to talk a little more about that. So how do we strengthen our capacity to act? How do we build our power? Through people, narrative, and resources. So today we're really talking about focusing on that people part of the overlapping circles, because we're talking about building relationships, but they are all overlapping for a reason. For example, CHWs have the power to directly impact decision makers, people, by developing relationships and aligning interests. CHWs have a shared story, a narrative of deeply held cultural perspectives that come from a shared history. And we can align that narrative to build public understanding and support, to build collective power. And CHWs can influence the way that resources are distributed, especially if the people's interests and the narrative are aligned. That's like the intersection, the center of where those three circles overlap, right? We can go to the next slide. So really want you all to be thinking about here. What power do you already have to advance CHW sustainability? Because everyone who just completed that exercise can see that they have power through their relationships and what they're able to learn, or how they're able to access resources for themselves or someone else in their community, or to make change happen, right? Those are just some of the many ways. So all of you already do have power. No one is starting from zero because of the relationships that each of you have. And so what we want to do is give you all a couple tools that you can walk away with today that were shared during the summit and through some other programs within Envision that can really help you to start to assess the power and that you already have, and help you to determine which direction you might want to go next as it pertains to sustainability goals in your community. Okay, next slide, please. So these are two different resources. We have a CHW partnerships table and resources inventory. I'm going to talk about the resources inventory first, which the lovely Monique just dropped into the chat for us. Thank you, Monique. And I want to emphasize again, this work and these tools specifically, we offer a lot of tools, and some of them require a lot of context and background building to really be able to wrap your head around and have the full use and impact of it. These are things that anyone can start with, and we're helping you all get started here and now. Or if you're already in the middle of implementing something, it's always a good idea to just continue to do these exercises and assess where you are. So again, no matter where you are, you don't need Medicaid reimbursement or even to have a network or association in your state. Anyone can start here with an inventory of your current relationships and resources. So when we're talking about the resources inventory, which again, you can see the PDF that's been dropped into the chat, or for folks who are CCR 2109 recipients, you can also find this document in your virtual binders. And those are the two places that you can access that tool specifically. So when we're talking about different types of resources in this inventory, think about staff. And when you're thinking about staff, what's the time, experience, and expertise? We're talking about lived, administrative, policy, programmatic, advocacy. What are all the different kinds of experiences that staff might have? That's a resource, right? core skills, what analytical, they're really good communicators. They can facilitate certain trainings or projects. They have experience with research or with fundraising. Those are, again, all resources to you and at your disposal as it comes to trying to move your sustainability goals forward. Funding, we're talking about monetary resources, like grants and things like that, or non-monetary and non-staff related, like volunteer time, in-kind donations, or just having access to resources. Organizational reputation, this is something that I heard and people talk about that came off of mute and also saw in the chat. It's that trust built that, hey, we've done all this now and we have a good trust with the community, and they know they can come to us and they can ask us for things because we've shown up for them. So what is the organizational reputation with your organization? The proven impact, or the credibility that you all have, your general perception as a quality organization. Those are things you can think about as resources to you. And then again, our relationships. So we're talking about CHWs and CHW allies, who are the decision makers in your community, in your state, who are different partner organizations, the networks, the CHW networks and associations or other associations that you have relationships with, and coalitions. So this is a tool that is a really, really great place to start, just to really be able to see what is everything that you already have, and to be able to come at it from an asset-based lens and look at your strengths, look at all that you already have, because again, no one is starting from zero. So that's one tool. That's a great tool that you all can walk away with and practice using and introduce to other folks and share it. And then the partnerships table. So this one is more specific, and this one can be found in the participant guide that's on the Envision website. And you can see what it looks like on the left of the screen there. So it's really identifying who are the major players in your strategy for CHW sustainability in your community. Who are the decision makers, and who has influence on those decision makers? Who are just the top 10 priority partners, the people you know you need to work with as it pertains to CHW sustainability in your community. And maybe you're not totally sure. That's okay. You can just start to brainstorm and list folks out, and it will all fall into place. The second part of the partnerships table, you can see we have some boxes. And again, when you pull this up through the participant guidebook, you'll be able to see it there. Or for CCR 2109 recipients, you can also access this document in your virtual binders. This partnerships table will help you to identify who you need to build relationships with to advance sustainability goals in your community, and then helps you to categorize those partnerships based on the influence they have in relation to your goal. So are they the person who makes the decision? Maybe they're not, but maybe they do have a lot of influence over the decision maker. Or are they in opposition of what you're trying to work towards, but you know that there's someone who's going to be a key player as you're moving things forward? So being able to start to think about that is another place that you all can start. And I didn't say this already. I meant to say the Midwest Academy, this resources inventory, we adapted that, Envision adapted from the Midwest Academy, which is community organizing training. And you all will see that at the bottom of the PDF too, if you want to learn more, because they have incredible resources. So these tools are really to help you identify, again, the individual and collective power that you already have or that you need to achieve sustainability in your community. And having an understanding of the power that you already have in your relationships through your partners and accessible resources will also help you to determine which method is best for your community based on your strengths, which means a little bit less work because you already are going to have a place to start, right? You're not starting from zero. Again, want to emphasize that folks can access the partnerships table in the participant guide. Anyone can. And then CCR 2109 recipients can access both these resources in their virtual binder. And then you all see the link that was dropped into the chat, the PDF for the inventory of resources. And if you have any questions, this is a great opportunity to put in a TA request if you are a CCR 2109 recipient, or to send us a message if you're not sure how to do that, saying, I want to do this, but I'm not sure where to go, or I did it, can I have some feedback? Absolutely. Yes. We're here to help support you all through this. And if you're not a 2109 recipient, send us a message anyway, because we really care about this and we want to build relationship with you. That's how we're going to make this all work. Doing this on the local level and then connecting and being able to do it together on a national level and having those two being informing one another. So I just want to thank you all so much for the time. I know that's a lot of information and I appreciate your participation. I'm going to pass it off to Yasmin, who is going to talk more about CHW allyship and the role of CHW allies in sustainability.
Thanks, Essie. I'm going to go ahead and take a deep breath before we pivot a little bit. So I invite you all to take one too. And I think we're going to segue to talking a little bit about allyship and resources. Again, this is all very connected to sustainability in general. But allyship, so Envision has talked a lot in the past about allyship. We actually had an allyship webinar. We're going to drop the link in the chat if you want to go review it and watch it. It was essentially a really amazing panel of CHWs and the allies that they collaborate with and kind of telling their story of how they work together. So I'm not going to go super in depth, but because this is so foundational to sustainability work, I just wanted to be able to elevate some really key themes around allyship before we talk about resources. So what we saw coming out of the summit was that now more than ever, allies play a very important role in sustainability. Again, sustainability is very possible, but we hear from CHWs that CHWs need the structural support to actualize their roles as leaders. If that resonates with you, would love to hear in the chat, but this is something that comes up a lot. So for the purposes of Envision's work and sustainability and this webinar, we're going to use a definition of allyship. CHW allyship is the actions, behaviors, and practices one intentionally takes to support, amplify, and advocate with CHWs towards the sustainability of the CHW workforce. I want to note that we say advocate with rather than advocate for, because advocacy should be done in partnership. So again, definitely check out the website to go dig deeper into that, but that's a general definition that we're going to be using for today. So next slide, please. We're going to bring back this pyramid that Essie shared, and I want to direct you again to the very bottom of the pyramid, right? That's the foundation, and it's CHW leadership and the CHW self-determination policy, nothing about us without us. And so in terms of allyship, one of our most important roles as allies is to uplift CHW leadership and voice. And so some examples of allyship functioning as part of the CHW workforce in an authentic way is, for example, joining a state or national association. So if any of you are not members of the National Association of Community Health Workers, NACHWA, I really recommend going and learning more about NACHWA, getting connected, and seeing if that's a good fit for you. So that's a really powerful example of getting connected. NACHWA is doing the really amazing national policy work that is so integral to CHW sustainability. And as allies, with our positionality, our different roles in our different organizations and spaces, being able to be super informed and plugged into that work is very important. Also, if your state has an association, for similar reasons, getting plugged into that state level conversation around the CHW workforce is really, really important. Also, CHWs being able to lead and get credit for shared work is a huge role that allies can play to support that. If you publish something, include CHW voice, co-author with CHWs, have their names on the publications. If you are presenting at a conference, whether that's a national conference like the American Public Health Association, APHA conference, or a local conference, have CHWs presenting their work, presenting their voice. That's something that we can do as allies that is really, really integral to supporting CHW leadership and voice. Another really important aspect of allyship is policy work and partnering with CHWs on policy work. So really great example. So we're seeing a national shift for CHWs with the new Medicare and Medicaid policies and the physician fee schedule. If you all are unfamiliar with what I'm talking about, Envision has a webinar that went really in depth in that, but that is basically a policy that's going to have really big implications for reimbursement for CHWs. And it is going to take a lot of advocacy to kind of put that into play. And so that's a really great example of policy endorsement. Another one is, so for example, APHA has a policy on CHWs as violence prevention experts, and that was co-endorsed by CHWs. So every step of the way, CHWs' voice is informing and really amplifying the work that we do. So think about what that looks like in your corner, in your work, in your organization. How are you supporting CHW voice and leadership at all levels that you're working in? So I really just want to lift up that role as allies because it's going to be absolutely imperative to sustainability. Next slide, please. All right, and another really important role as allies, or a really important role for anybody in this room, is sharing resources. So we talk about relationships as power, but information is also power, and connecting people to information is within our grasp. It's something we can walk away from today and do immediately. So what's learned at the summit leaves the summit, and I really want to share and elevate some places that you can start supporting capacity building for CHWs and programs by accessing some key resources. Essie mentioned this, but I just want to say one more time. If you are a CCR 2109 recipient, you can always put in a TA request with us to talk these through further. And if not, send us an email at our hello@email address, which should be in the chat. And we would love to get you connected to the resources that you need. So we don't have to start from scratch, and here are some ways to get plugged in. So Envision, on our website, we've developed a resource library. This resource library has 8 different categories, including sustainability, and they are all CHW vetted resources, meaning that CHWs have looked at all these resources and said, yes, this is useful for our work in the field. This makes sense as part of our toolkit. And so we've really been intentional about collecting amazing resources that have been floating around, that have been created by whether it's national organizations like NACHWA or APHA, or even state health departments. So we have, I'm going to share in a minute, a really great example coming out of North Carolina of a state level sustainability plan. So all of those are on our Envision resource library. We're going to put all those links in the chat so you can go look at it. Those are available widely to the public, so it's a great place to go share. We've even heard from CHWs that they use the resources in our library as part of their training curriculum. So definitely go check that out. My Envision is Envision's virtual community space, if you will. I also want to pause and say that in a minute, I'm going to walk you through a screen share demo of what all of these look like and how to access them. So if you're a visual learner, bear with me and we'll walk that through in a second. So My Envision is a community platform and a real-time resource sharing database I'm going to show you exactly what the different functionalities are, but essentially we wanted to provide a space for CHWs and CHW allies from across the nation to be able to connect with each other, to share resources in real time, talk about your successes, talk about your challenges, and really bounce ideas off of each other and connect with one another. So if you aren't a member, I'll show you in a minute how to become one. And then we have some resources that came out of the summit that are now available. So this is really exciting. This is the first time that we're launching, so to speak, these resources. So all of the plenary and keynote sessions from the Sustainability Summit are available to the public. We recorded them, and they're available on the Envision website for you and anybody else to go watch and learn from. So I'll share exactly what's in there with you momentarily, but those are a really great way to connect to like the key juicy bits from the summit. One of the amazing examples are Denise Octavia Smith, who is the director of the National Association of Community Health Workers, did an amazing opening keynote for us, and you'll be able to watch and learn from Denise, among other examples. Also, for the summit, all the participants, when they came to the summit, they were given a participant guide and reflection journal. I have a virtual background, so I don't know if you can see that, but it's essentially a resource that Envision developed along in collaboration with national partners of key resources to sort of track your sustainability work and kind of get connected to the different chapters of the summit, so to speak. But even if you weren't at the summit, this is an incredible resource for you to start really reflecting on where you're at in your sustainability work. Essie talked a ton about inventories of your relationships and your resources. And so the guidebook is a really great place to start. There are worksheets, prompts, resources, reading material. So if you're the kind of person that needs to walk away and process something before you come back and start digging into it, and stuff that we talked about today regarding sustainability, allyship, relationships, power, resources is resonating with you, this would be a great place to start. And so that is available publicly in both English and Spanish as a PDF on the Envision website. So we're going to see what that looks like in a second. But I really want to reiterate that all of these things that we're talking about are our way of saying that you can walk away from this webinar today and have some tools to start digging in and working in. So no matter where you're going, you'll be able to walk away from this with some really great materials for working in. So I want to also give Essie a chance to describe the portion of the sustainability guidebook. The first half of it is resources, and then the second half of it I'll talk about in a second are national partner resources. So Essie, could you walk us through what the first half of the guidebook looks like?
You betcha. Are you going to be screen sharing that, Yasmin?
Yeah.
Okay,
Would you like me to do
awesome.
that while you talk or after?
I think that would be helpful. Can I have like some nods or thumbs up or something in the chat if people want the screen sharing now? I'm a visual person myself. I'm seeing some thumbs up. Okay, yeah.
All right.
Thank you. Thank you, Lori and Olga. Thank you to other folks, Rachel. Thank you. Okay.
All right, let's do it. So
Alrighty.
this is the good old Envision website. If you go to the top and you go to Summit and Summit Resources, that's where I'm at right now. And you scroll down and we're going to go to the Summit Journal. So as you can see, you can access it in Spanish here, but we're going to go ahead and go to the English version for today. All right, Essie.
Okay, awesome. So as Yasmin is kind of scrolling on through, when we get to page 2, with the number on it, you can see kind of an introduction of our framing for the summit, which you're welcome to read, and kind of what Envision's strategy and how we work with partners to put the summit on. And then page 2 here has that index of what's going to be included. So we have an overview, the things that we just talked about, when I reviewed those graphics that illustrated some of the approaches that Envision uses, those are going to be really in that CHW Sustainability Summit overview section. So you'll have a recap there. And then relationships as a source of power. You all know, we just talked about that a lot. So there's going to be a section on that where you'll see the partnerships table. And in addition to that, you're going to see understanding motivation and self-interest, which is how to have, how to build that relationship with people, how to identify what they truly care about in order to align it with what you care about and be able to build that power and relationship in that way, in an authentic, meaningful way. And so there is going to be some exercises that are inside the workbook that you can use there and some tips on helpful things for a one-to-one meeting. And then after the partnerships table, more about power building, there's going to be a very, very small introduction to using power maps, which that's something that, again, we train on. And that for folks who are CCR 2109 recipients, you can watch a video training inside of your virtual binders. And there's a good, at least, introduction to what this tool looks like and how you might use it in the guidebook here. And again, please send us an email if you all are interested in learning more. And then sustainability goals was that next section where we have some worksheets where you all can start to brainstorm how you are setting sustainability goals, and about financial sustainability, and gives an overview of some of the things that we talk about in the financial sustainability toolkit that Envision has created. And the virtual binder and tools just give some folks some idea, especially for folks who are CCR 2109 recipients, how they can access and utilize some of these additional tools. And then something that is really great, I'm so glad that Richard, I believe it was, who lifted this up earlier in this last section about Sustainability Summit reflections, we have for day 1, 2, and 3 of the summit. However, these are just great things to have. If you want to actually scroll down to that section, it's at the very end, Yasmin, where people can, when you're having these one-to-ones and conversations with folks, this is where you can utilize something like this as a template for when you have a conversation with someone and you want to remember, who did you talk to? What do they care about? What's their contact information? Something like this is a great way to keep track of the folks that you are building relationship with, and what they care about and how you might be able to work with them and they can work with you. So if you continue to scroll through, and Yasmin, if you want to go back up, we're kind of going a little bit out of order. But you can see it talks about some of the financial sustainability toolkit and the virtual binders that all CCR 2109 recipients now have. And this is the section on the left side of the page, setting sustainability goals, where we say to put the goal inside that colored box, that cream colored, like that peach, that red, and that purple, to put the goals in there. And then benchmarks. How do you know? What are some benchmarks that you know that you've been reaching that goal or that you are getting close to reaching that goal? So those are some things that you can use with your team and in your community. And then support needed. What's needed to help you reach those goals? So those are some tools that you all can use.
And this kind of goes through explaining what Essie said about the benchmarks and the support.
Thanks so much. Yep, that's exactly right. And so this is kind of the part 2 to the partnerships table. So for folks who want more information, let us know about the power map. But once you have completed that partnerships table, that's on the pages ahead. Once you've put all those people on the list, and you can go down a little bit again, Yasmin. Once you've put them on the list on the left, and then put those people, how they're categorized based on what kind of influence or power they have, or opposition or support on the right, the power map is intended to be something that's used after that. And we can go up ahead again. And this is kind of what we were speaking to before, how to prepare to have a one-to-one with someone where this is the basics for how to build an authentic, meaningful relationship, which is really second nature to any CHW who's working in the field. This is something that you all do. So this is just something if you're feeling nervous, or if you're having a cold call or something because you know you want to build a relationship with someone, these are some tips and tricks that can help you really get to the heart of what somebody cares about and to learn about them. And these are some more tips on how to do that. How to discover what they care about, their self-interest. And this section, if you go up a little bit higher, is really helpful. We talked about relationships as a source of power, but I really encourage folks to look at the relationship building guiding questions here, where it has some prompts, like it says, what power do you already have to advance CHW sustainability? And we talked about that. And we say an inventory of your current relationships and other resources informs this. So that's what we really talked about today. That's that first step. And then here are the following tools that can help you answer these questions. So this can be really, if there's only one thing that you look at in terms of the tools, not the resources that Yasmin's going to share later, this is a great place to start. That's just, what power do you already have? What are you trying to achieve? And the tools in the guidebook that will help you. What do you need to strategically strengthen your relationships? And it has a bunch of prompt questions to really help you all think about what you might want to do. What are your next steps? And these can also help you think of knowing what kind of support you need. If you don't know how to answer a question, that's okay. This might be a good time to ask, either reaching out to us for support or someone else. So that's a really quick overview of some of the tools that are offered there. And please reach out to us with anything that you might have a question on or that you want to learn more about. We're here as a resource to you all.
Thanks, Essie. And while we're in here, I'm going to scroll to the back of this book. And I want to show you this section that is called Resources from Envision and National Partners. So essentially, Envision is working to sort of align the national narrative. So there are all these incredible organizations. We hear these acronyms constantly: APHA, NACHWA, NASHP, ASTHO. And I think it can get really confusing to know who all these organizations are, what they do, and why it matters to our work, especially if we're working in community. Kind of knowing what's happening at the national level and how it connects to the work that we're doing at community, I think can be a little bit complex. And so Envision collaborated with these partner organizations to kind of break that down into some digestible overviews and really pointing you to where you can go to see their resources and learn more about the work that they do and how it can apply to your work. So basically you can see the table of contents here. So there are CHW focused organizations like the CHWA is the Center for Community Health Alignment, or NACHWA, the National Association. And then there are ally organizations, so like the American Public Health Association or CDC, Center for Disease Control. And so essentially, each of these organizations gets an overview that explains who they are, what they do, some key examples of their work, and sort of why it matters for the CHW workforce. And if you go to the Envision website, there are clickable links to all of these resources. So I think that's also a really good place to start if you're really starting to think through sustainability and wanting to get plugged into the information and examples and connect with folks who are deeply embedded in this work at a policy level or an evaluation level. This kind of breaks it down for you, so to speak, and then also gives you a point of like how to get connected and how to find more resources. So want to highlight the National Council on Community Health Worker Core Consensus Standards, the C3 Council. That used to be called the C3 Project, if that sounds familiar, but C3 really develop the national roles and competencies of community health workers, which is really important if we think about sustainability, that we have consensus on a national level of like, what are the roles CHWs play and how to sort of describe that consistently to people who make decisions that might not be rooted in community the way that we are. So really important organization, and you can go through and see some of their work here. So I really encourage you to go through and read all of these, look at the resources, get familiar, and be able to share this with your organization, with the CHWs that you work with your communities, because this is really the baseline of the national CHW workforce and all this work that's happening. Sometimes it can seem disparate and sort of like it's separate, but it's really not. It's all part of the, I don't know if you've noticed, the logo of the summit was a quilt. And the reason that it was a quilt is because we really are sewing all these pieces together into one cohesive quilt of sustainability, so to speak. So I wanted to point you to that. And again, those links will be in the chat if you want to go check that out further. So I'm going to stop sharing my screen really quick and get back to our presentation here for a moment. I want to make sure that I did not forget anything. So I also want to point you to a really great example of a state level sustainability resource. At our sustainability summit, Envision Sustainability Summit, we had a keynote presentation where North Carolina, some folks from North Carolina came and did a keynote where they told the story of the North Carolina Community Health Worker Association working together with the state health department to create a sustainability plan. So when we talk about allyship and we talk about relationships, this is an amazing example of CHW voice and leadership being elevated at a state level to create what their sustainability plan looked like. So we have that in the chat for you. Not only can you go watch that keynote to hear for yourself from that group, hear their story from the recording from their session at the summit, but you can also read and access their sustainability plan as a resource. So again, really amazing example. I encourage you to go familiarize yourself with that story. When we say sustainability is possible and authentic allyship is possible, it's all in this story. I also wanted to point you to My Envision. So I mentioned My Envision is our community platform, but I'm going to share my screen, show you how to go in there and how you might use it to kind of hold each other accountable to all this stuff that we're learning today, continuing your learning. So I'm going to share my screen one more time. And I'm going to show you what My Envision looks like. So when you go to My Envision, you're going to see a page that looks like this. It's the feed. So there are different communities in here. Communities are like very focused pages. So for example, we have CHW Allies community. If you're an ally, this is a space for allies to come together to share your specific successes and challenges and learnings and connect with each other. But CHWs need their own space, right? So we also created a CHW space for CHWs to connect away from all the other larger conversations, just to get together in a safe space to connect, to meet each other, to learn and share. And the My Envision community is the main community for everybody that you will join when you join My Envision. And so as you go through, you can see you can make different kinds of posts. Whether that's posting a photo. Let's say you just had an event and you want to post a photo and share about it. Our CHW Association had a conference. You can actually go and share a picture and a caption of what that was like. We share every Wednesday, Resource Wednesday. They're really important sustainability focused resources that we're sharing for awareness. So that happens every Wednesday. You can post events in here if you want people to know about events or different opportunities. So this is a call for presenters for the Southeast Community Health Worker Network. So it's really our way of giving the mic back to you all to use this space as you see fit, but with really the focus on relationship building and offering another space outside of like a Zoom chat where you can get together and meet each other. Another really cool functionality is, let's say you meet somebody and you want to find them on My Envision, you can type in, like I can type in Essie and Essie's profile comes up. Or let's say I want to look up California. I can type in California and folks from California come up. So if you're like, I want to connect with folks from my state, this might be a great place to start. And you can send direct messages to people if you want to start a conversation. We also have capacity to provide more communities in here if there is a need. Like, for example, we heard that there was a need for CHW associations. And so we were able to create a community for that. So I encourage you to go in My Envision. When you log into the website, you can create a profile and start using this right away. So I want to be mindful of time. We are going to do a Q&A as well. So I want to spend a minute just wrapping up. We shared resources. We shared resources in general, but we also shared 3 really tangible resources that you can walk away and really start digging into and take some action with, which was My Envision, joining My Envision, the national partner resources and doing your research and getting connected with NACHWA and other organizations, and going and reading North Carolina's sustainability plan and watching that keynote and hearing their story of the state CHW association working together with the state health department and what came out of that and what it looked like. So I think that we can go ahead and begin our Q&A shortly, but on the screen real quick, we're going to share some QR codes to all these websites as well. So you can scan those and go in and access My Envision and the Envision website if that's an easier way for you to get plugged into some of the things that we talked about.
Yeah, so we could begin with our Q&A session right now. We had a question previously from Sherry. Sherry, I'm just gonna say T for your last name. I don't want to mispronounce your last name, but she had asked, how do we keep the grassroots power, influence, and trust strong while moving towards sustainability resources? I think from my experience inside community as well as health models create conflicting objectives. And then, Sherry, I don't know if you're still on, but do you want to elaborate a little bit more about your question and comment?
I don't see her list in the list of names anymore.
So we do have another question. It is in Espanol. I see your Sherry. Are you able to take on that question? Sorry.
Can you hear me? This is Sherry Tawhid.
Yes.
Okay. I didn't. So my concern in a positive way, because I definitely believe CHWs are here and they're here to stay, but the power and then the dumping of responsibility. We are community health workers. So we are really charged with working on behalf of the community, but the medical model and the system sees our benefit and is using us to get information and education out. That is the real plus there, but also taking on their agenda, and then how much my concern was being overworked, especially during the pandemic and after. How many people can I sustainably help and support as an individual when case management and social workers have a manageable number? And when I would go to my population health manager, she had no answer for me, because I think that is a disservice to community when there's 1 or 2 community workers for the whole clinic or hospital. So I just wanted to present that to the group, and I apologize if that took up too much time.
I see you look like you want to answer the question.
I can speak to some of it. From my personal experience, I think, and with organizing, what you're speaking to is something that I think so many different people here on this call can relate to. And I think that part of it is about the work that we're saying explicitly, which is clearly some of these things or policy or grants or anything that might have been written and the way that people are being funded isn't necessarily incorporating CHW voice, because when CHW voice and leadership is integrated into how these positions or training or anything, or the way that a job is going to look, when they get to be a part of that decision making, then we see it being aligned with the CHW values and what we're saying, what CHWs want to do and what CHWs should be doing in their community, right? So I think a part of it is about just building that power and building that power for allies as well in those relationships, so that when we have those relationships with individuals, they can see and be able to be the champions for, like, hey, actually, we can't have CHWs doing that here. Or like, actually, we know that we need to be, like, CHWs need to be a part of writing this, and we can't have them having this many people on a caseload, or et cetera, et cetera. So I think that in the short term, it's advocacy and transparency as we're talking about trust with the community. And I think in the long term, it's about building that power so that it's CHWs creating equitable policies and positions and roles as they're working in, so that we're not completely being medicalized. Not to say we can't work in hospitals, CHWs, but that if they are, that it's in a position that they're still going out into community and going into homes, and being able to uphold CHW values. So I think there isn't a one size fits all answer to that. And I would open it up to, other folks on the team who wanted to comment, or if there are other folks who are on the call who have something that they want to share.
Yeah, I was gonna call on LR to see if she wanted to answer the question as well, because I saw she was on.
Hello, everyone. And yes, I responded in the chat, but I think that's why it's so important that, we as CHWs really begin to step up and become engaged and involved in many of these conversations, as well as providing, leadership around sustainability efforts, program implementation, as well as program development. And I guess I want to add, one way that we can do that is to really become engaged with what's happening in our state through our statewide associations, networks, and also Notch One nationally. Thank you.
Thank you, LR. Do we have, okay, so I see another question. Are there from Carl West? Are there any resources on strategies for equitable payment for undocumented CHWs?
I don't think we specifically have resources on that topic, but I will definitely make note of that, and we can get folks connected. If we can look for that. Thanks, Carol, for lifting that up. And we're always happy to hear what resources you are looking for and help get you connected. So feel free to put those in the chat or email us.
I wanted to say I signed up for this workshop because it was very provocative and interesting. It came through Mark. So I was not familiar with Envision before, and I don't know how many people on this call or Zoom are. I'm from the Kansas City, Missouri area, and I wanted to thank everyone for sharing, and this has been very useful to me.
Thank you. We love to hear that, Sherry, and we're glad to have new faces and new folks joining us. And we're just really here to share our knowledge and share resources and partner with anyone that we can. I know we are on time, but if you all have additional questions, please feel free to email us. And if you're a recipient, please feel free to put in a TA request as well too. I know we had a lot of great information being shared in this webinar. but I do want to be mindful of everyone's time. So can we go to our next slide, please, Caitlin? Okay, thank you all so much for joining us today. We cannot wait to see you all next month. So have a great day, everyone, and thank you for joining us.